Hey everybody, Nick Licameli here with Technique Peak. Today we're talking about hip pain during a squat and why the solution may be easier than you think. Many times, especially in the young athlete, what I see with a squat is a hard arch in the lower back. So when they initiate their squat, they go into that hard arch and then they come down and do their squat and never quite get out of that lumbar extension. That hard arch and the anterior pelvic tilt is going to move the socket on the ball of your hip joint. So when you go down into your squat, there's only so much room that the femur can move in the acetabulum. And by going into that hard arch, you're starting your squat in hip flexion. So as you descend, you're going into more and more hip flexion, which at the bottom of a squat can cause impingement. So a simple way to fix this is just teach proper squat mechanics and a neutral spine rather than that hard arch. So after the patient is able to find that neutral spine and feel what that feels like and keep that there, one of my favorite ways to work up to a proper squat is with a goblet squat. A goblet squat, the weight is going to be in front of you, which I find is an easier squat variation to keep a neutral spine. So we're going to find that neutral spine, lock that in, and come down, avoiding that hard arch. And what I find is that a lot of times that relieves that hip pain. So next time someone comes in and complains about hip pain at the bottom of a squat, be sure to first assess their mechanics of their squat, rather than just diving in to joint mobs and soft tissue work. All those things are great, but sometimes the fix is as easy as a small change in mechanics. I hope this helps. Thank you so much for watching this episode of Technique Peak, and we'll see you next time.